Yeah, where do I do it? Click on it?
Yep, you're good.
Okay. Now I can follow it.
Commissioner Baker McCormick, Commissioner Marecki, Commissioner Anderson,
Present.
Vice Chair Colleen,
Here,
Chair Scott has requested an excuse. You have a quorum present.
thank you. Next item.
B, Chair's remarks.
Yeah, just a couple of remarks here, because Chair Scott did request an absence today. So the vice chair is stepping in. I hope all committee members got the addenda. Came to us half hour, 40 minutes ago, so everybody has that. The other comment I'll make is the first item is a proposed ordinance. And just so that there's a heads up, I'm going to be asking for Corp Counsel to kind of introduce this and what this is and what it means. Are we ready for that? Okay. So I want to hear from Corp Counsel on this, and then we'll have a little bit of discussion, and then we'll go to a public hearing. So any member of the public that wishes to kind of hear a discussion before they have their comment. So that's how we'll handle item 1. I'll also point out that items 3, 4, 5, 6, and 7, those 5 items are the quarterly adjustments for our CMO. So we can take those all together, and then we'll have 2 items on the agenda to discuss. So with that, Madam Clerk, what is next on our agenda?
C, approve the May 14th, 2024 meeting minutes.
We have a motion by Commissioner Anderson, a second by Commissioner Baker McCormick. Any additions, changes to the previous minutes? All in favor, please vote yeah on your, well, whatever you want to vote. You can do any of them.
Motion carried.
Thank you very much. Next on the agenda, Madam Chair, or Madam Clerk.
D, unfinished business. There is none listed.
Sure, we'll make it, Chair. What the heck? Next item, please.
Item 1, under new business, requesting commission approval of proposed amendments to the Wayne County Code of Ordinances to amend chapter 173 of the Wayne County Code of Ordinances, the sale of paraphernalia ordinance to amend section 173-1 to include a definition for drug testing equipment.
All righty. Commissioners, you got a strikeout version in your agenda today, but it was both strikeout and additions. The strikeout was in red, the blue was additions. So you got that all in one document, but I also got the clean copy so that you have a copy of after all those changes have been made. Corporation Counsel ready to, or somebody ready? Yeah. To discuss, and Commission Counsel, yes.
So before we start, through the chair to this honorable body.
Yes.
So at full board, this had first reading and it was passed to committee. Since full board, several changes have been made to the document. So for the motion, we will be substituting the red line version that was actually handed out for the version that was approved. So we'll be doing amendments. So our motion will be as amended once we get to that point.
I see. And that still is good in terms of,
Yes, the public hearing and otherwise.
yeah.
Yes, we are allowed to modify as deemed appropriate and
And this,
necessary.
does this go back to full board then?
This will go back to full board,
Okay.
whatever is approved out of committee.
As amended.
Yes.
Thank you. Okay, if people would like to introduce themselves and tell us what all the changes are in our ordinance, please. Proposed changes.
T.R. Winter from Corporation Counsel.
Dr. Chef, Chief Medical Officer of Wayne County Health, Human and Veteran Services.
Okay, thank you.
And to introduce the legal changes is that this is an update to the county's paraphernalia ordinance in response to the passage of time, changes in how and what drug treatment programs are considered generally appropriate and acceptable in Michigan, as well as some of the initiatives of the county, as well as the state of Michigan and the federal government in dealing with substance use disorders. And Dr. Sheth can give a little more background on that.
Sure. Thanks, TR. So just want to provide a little background behind what we're trying to do here and what we're proposing in terms of changes to the Wayne County Drug Paraphernalia Ordinance. And just to provide some context, in Wayne County, we've had nearly 100 overdose deaths. This accounts for about 1/3 of Michigan overdose fatalities. In the state of Michigan, we're only 18% of the population. So the disproportionate burden in Wayne County. We know that the primary driver behind these overdose deaths, 4 out of 5 of these deaths are driven by fentanyl, powerful synthetic opioid fentanyl, which is 50 times stronger than heroin, 100 times stronger than morphine. And we know that the drug supply has changed considerably over the last several years, where fentanyl is not only showing up in opioids like heroin, but also many other drugs, including cocaine, methamphetamine, counterfeit pills. And so we know that this really broadens the risk out there to our community, to folks that are not just only struggling with opioid use disorder and substance use disorder, but really anyone who chooses to use a substance is at risk for an overdose fatality. And so what this has taught us, the emergence of fentanyl in the illicit drug supply has taught us an important lesson. We really need to be informed, and we need to empower Wayne County residents and communities about what is in their drug supply, in the substances that they are using to save lives. And so what we are really trying to do here, and this is recommended by the U.S. Department of Health and Human Services, Centers for Disease Control and Prevention. This has been a evidence-based public health strategy that has been recommended that communities implement for quite some time to really increase access to these what's called drug checking or drug testing equipment, or also known as the test strips that we've spoken about before, to really empower communities and individuals to reduce their overdose risk and deaths. The issue is, through our 100 naloxone vending machine and access points that we are implementing throughout our 43 communities, they will all have these test strips. But what the barrier is that we have right now is that our paraphernalia ordinances that are in our books, it's not just us, it's in many other communities around the state of Michigan and around the country, they have not kept up with evidence-based public health strategies. And so we're rolling out these established and accepted strategies, but our ordinance right now is in direct conflict with that. And so we hope to correct that with these proposed changes. The other piece that I want to highlight is that the current paraphernalia ordinance really creates significant barriers for community-based health providers that are really the access points for individuals to access these evidence-based harm reduction services in all our communities in Wayne County. They have significant barriers to provide these services right now with our paraphernalia ordinances currently as written. And so just to provide a little context behind this, the city of Detroit has already went through these changes to their paraphernalia ordinances to allow exemptions for these providers to provide these services. The state of Michigan has already updated their ordinance as well. So we're almost like trying to catch up here for our out Wayne County community specifically. There are about 17 harm reduction teams or providers of syringe service programs within Wayne County that are operated under around 5 or so provider organizations. 15 of the 17 of these teams operate in the city of Detroit. So really only 2 really feel comfortable going into out Wayne County to provide these services, primarily because we have not done our job with updating this ordinance language to keep up with what is established public health practice now. And so we hope that through these changes, we are making a critical step to increasing access to these really life-saving services and providing this access throughout our Wayne County communities and to deliver these evidence-based life-saving supports to reduce overdose prevention and harms associated with substance use.
Thank you. And I see we've been joined at the table. Your name and title, sir, just so we.
Oh, sure. Denard Haggins, Assistant Corporation Counsel.
Oh, thank you for coming today. Do you have any other comments on what we're looking at before us from?
Not at this time.
Okay. Sounds good. We'll we'll go to some discussion with commissioners and any questions, Commissioner Marecki.
So, Doctor, with us doing this at the county level, how about the cities and townships? Do they have to further do something, or does this kind of cover them because they're in Wayne County?
Yeah, so you bring up a good point, and I'm sure TR can chime in as well, but yes, you are correct. You know, the most cities and townships, municipalities have their own paraphernalia ordinances on the books. They would have to do the work to update those changes as well. I think what we're trying to do is really lead with that and, you know, exemplify what we're trying to promote in our changes as well. There are a couple of communities that have made significant strides in updating their ordinances, but many of the municipalities in our Out Wayne County communities do have paraphernalia ordinances also that do need to be updated.
And this is just kind of on the side. Our machines that we're putting,
Mhm.
they're going to have the Narcan and the strips in it. Is that it?
Yes, yes. The initial rollout will be the naloxone and Narcan kits, and then the test strips. Mhm.
Okay, and when you say initial rollout,
Yes, that is what is in the machines right now. Mhm.
is there any future thoughts about putting other things in the machines?
Not at this time. I mean, I think we're really focused on increasing access to these harm reduction supplies.
And are we going to be able to track any statistics from this? I mean, do you just look at the machine and see what's missing? Like when you're doing inventory at a store? Or,
That's part of it. So we are, you know, we have a great partner in this, Wayne State Center for Behavioral Health and Justice, who are our program implementation partners and have, you know, a significant expertise in rolling out these machines and access points in various communities. And so we're going to be working with them to monitor, you know, access around these, you know, do surveys around, you know, use of these machines, including the folks that host these machines, to really learn and hopefully iterate and continue to improve delivery of these services.
I'm wondering if we could get some kind of report every 6 months or something, or whatever it is, to see what's going on with the effectiveness of this.
Right.
I mean, whatever
Yeah.
you guys get. maybe You
Yes.
could share with the commission in some kind of form that we could see.
Yeah, absolutely. You know, we're going to be continuing to learn as we roll this out, and we're happy to provide updates as that gets implemented.
Okay, thank you.
Commissioner Baker McCormick, who's next in line, just following up on your questions, Commissioner Marecki. At least from the start, because we're not going to be able to trace, like, you know, that was our Narcan that saved that life, you know, unless we have some sort of a tracer in there. We could say, oh, that was Wayne County. To start, we will know the volume that goes through these machines. And so I think in terms of a report to the commission, you can say, yeah, over the last 2 months, last 3 months, the machines were accessed this many times. This is how many strips went out. This is how much Narcan went out. And I think those are good numbers to start with, I would think. Colleagues? Commissioner Anderson?
Thank you. The only thing I don't think we would know is how many of those went out in a bundle where someone wanted them at their facility
Yeah.
Versus one at a time.
Yeah.
So, yeah, I think that's why it's not really a good indicator. I mean,
I gotcha.
we know how many are out there, but we don't know who
How
the,
they were
who,
dispersed.
exactly, yeah. Then that was a
Yeah.
concern I had before. What if someone goes in there and grabs a handful and 2 or 3 do that? And then what happens to that machine? How often is it replenished?
Yeah, so we're working with our partners to continually monitor these machines as they're rolled out and be stocked, you know, and we will, to avoid the scenario where a machine is running out and we don't have enough supply, right? And so that will be continually monitored and restocked. So we hope that that does not happen. We know that, you know, frankly, you know, we want these to be low barrier, non-judgmental access points, right? It's easy as it is. They can go in and there's no limit to how much people can take out. And at the end of the day, they're being used to save lives, right? And so if an individual decides to take out more, the end result is still the same, right? The outcome is still the same in terms of using it to save lives is what, our goal is, right? We know that from experiences in other areas in the country where this has been rolled out, that hasn't really played out as a big concern.
You want to pick up there, Commissioner Baker McCormick?
go ahead.
Go ahead. Okay, I didn't want to.
Yeah.
Thank you,
so
Commissioner.
Where else can people get Narcan? I mean, can they go into a pharmacy and get it?
Yeah, so now, you don't need a prescription. You can get Narcan in a pharmacy. However, they run around $30-$40, right? And some insurances cover it. And, then you have to talk to a provider. Some people don't feel comfortable talking to providers. So though that is great, that has eliminated that barrier, it is still a significant barrier for folks. So yes, it's available at pharmacies, but with a cost. Sometimes plans cover it. There are these providers that I spoke about earlier that are trying to provide increased access, so are in the communities trying to work with individuals who are struggling with substance use and providing access to these. There are ways that you can go, there's entities that mail to people's home. So there's a lot of different efforts. And this is our effort here is really, lifting the stigma off of substance use and using these life-saving tools and really just making it available everywhere, no matter where they are, and have access points throughout our municipalities.
Thank you. Thanks.
Floor is all yours, Commissioner Baker McCormick.
Thank you, Mr. Chair. So just wanted to clarify, you just talked about the cost. The cost of, was that my phone? I don't know what that.
No,
okay.
I think it's fine.
Oh, okay. That's like, what happened? Okay, the cost of the strips.
I was
In
speaking to the
stores, right,
Narcan, the
right.
naloxone, the spray, the overdose reversal spray.
Okay,
So not the test strips.
right, but how much are
Mhm.
those? Do you know, like can you purchase those in the
You
store?
can purchase
And
them. I mean, they're available online.
Okay.
Companies sell them. Amazon has them.
Do you know how
Um,
much?
They're
approximately?
typically around $1 or so a strip, I think. We can, find out.
No,
provide
it's no
some, but-
big.
but
I was
yeah,
just trying to get a roundabout cost. You talked about the locations of the machines
Mhm.
and are they inside or outside or do we have them out in all of the locations? Do we have them?
So we are working on implementation right now and rolling them out.
Okay.
There'll be a variety, we are working really closely with Wayne State and our municipalities and community partners to identify, what is, an ideal location. Each community could have a different type of location that is likely the better access point. So in this initial rollout, we're really working with our community partners and community representatives to identify the sites that, that would be a good access point, but also can logistically support them. So there's a lot of factors that are involved. The machines themselves do need to be inside and under some sort of shelter, but we're trying to have different types of access points where it could be a variety of locations, inside buildings that people in the public can walk into, under a bus shelter, for example, at a stop, things like that. So we're trying to mix it up and have a variety of access points that makes sense for that location.
Okay. So
Mhm.
would it be 24-hour access any day, any time or?
That's what we're working on with partners in identifying those points where there is access, at least, comfortable access, if not 24/7 in certain locations, but frequent, everyday, daytime access for the public to walk in. Yeah.
Okay, so we don't have any of the logistics.
Yeah, I can't speak to if every site will be 24/7, but those are all the thoughts that we are considering as we roll these machines out.
Okay.
So we'll be able to provide, as we identify locations and the logistics around them, we'll be able to provide more information.
Okay,
Mhm.
and as far as the locations, you're looking at the data as to how many should be in I guess in a zip code maybe, or
Yeah.
is it you're only gonna put one in each community? How are you going to discern that?
Yeah, so I think what we're trying to do is have access everywhere. So definitely throughout our 43 communities, have at least one access point in those. But then we're going to be using the data to really put more access points in our communities that are more impacted. And so we're looking at the data, we're looking at the EMS, overdose reversal data, we're looking at fatality data, and identifying locations where we do need more access within those communities. And so it's a combination of having access everywhere, but more access where it matters.
Okay, and have you looked at cameras at certain locations or maybe locations that already have cameras? Just so initially you can kind of see if, for the point that Commissioner Anderson made about people coming in and taking them out in bulk or one at a time as needed. Are they taking them and they're selling them? I'm just curious about how we could better monitor the machines without, causing a barrier.
Yeah. So, I think that we're going to be working with our, host partners with understanding, what is happening in and around the machine and getting some input from them. Our goal is, that we are getting these out there. And if it means that some people are taking more and we're getting them out there that way, then I don't think that that's necessarily a not desired outcome, right? Because at the end of the day, we're trying to just increase access, make these available everywhere. And so I think that's our main goal, but we'll be learning as we roll this out.
Yeah. I'm just afraid that, people take advantage of free
Mhm.
stuff, when it's free, but it is a good thing to have. I think there's definitely a need. So thank you for your work.
Commissioner Anderson?
Thank you. I have a few questions. Just curious about emergency personnel across the county. Has there been a survey done whether or not they actually are equipped with Narcan? All of them, police, fire, for all the communities and the 23 communities in the county?
Yeah, so generally, Wayne County has made significant strides at equipping all our first responders with Narcan. So EMS, police, fire, they are typically all having a Narcan on hand and trained on it. And so that's been great that they, all of our EMS providers have this in the field. And so now what we're trying to do here is really providing community access points, right? So the individual and community or family or loved ones has access to these. We know that the majority of overdoses happen in somebody's home. And typically somebody's around, right? And so to get this out into the communities where the overdoses are happening is critical because we know everyone doesn't call EMS.
So there has been a hard survey of all the communities.
So I'm not aware of a survey. We can kind of look into that and talk to some of our partners, but from our understanding is that, the EMS system and providers, police, first responders, are, basically Narcan is part of their toolkit as they go out in the community.
Okay. One of the other questions I have is, in developing this ordinance, who was involved in developing the ordinance? Was there police, prosecutors, law enforcement of some level?
So I can maybe defer to Corp Counsel on that, but I know Corp Counsel really looked at some model language out there to recommend these changes. We also looked at a lot of our other, City of Detroit, State of Michigan, some of our other municipalities and the languages that they've used to align as much as possible. But I will have Denard chime in if he has anything.
No problem.
No, you were on. There you
Okay,
go.
there we go. There was no consultation done with any of the entities you mentioned. It was just looking into some model legislation to see what was done elsewhere in regards to the issue.
I'm a little concerned with that because the fact that I don't know if something that's in this ordinance may inadvertently and affect law enforcement, how they enforce the law, and also with prosecutions. So I'm a little concerned about if they haven't been involved at all in the process. But I don't know if you want to address that, but I tell you that was it. I just wanted to, I think we should include them to get their response. It doesn't mean that that'll be the end all, but whether or not they see some problems that might develop from the change in this ordinance. Also, the location of the machines. We don't have a list right now of where those are going to be, right? I know where we're hoping to get them, and I'm supportive in general, but I also have some concerns, but I know they'll be watching with the rollout to see what problems develop, whether it's supply issues or whatever. And as that my colleague said, there's always someone out there who will think, well, if they charge, what'd you say, $30 in the drugstore, there's value there. And someone may just think they're going to make money but we'll have to see how that works out. But we know right now where these machines, we don't have a definitive list of where they're going to be located right now, correct?
Yeah, not at this time where it's a kind of an in motion thing right now where we are finalizing the initial sites to as we finalize the locations. But we're kind of in the midst of it right now to finalize these initial sites. So a little bit too early to provide information right now, but we will have that soon enough.
Sure.
Yeah.
And I would think that a good thing, once we do have that, the sites located, the locations set up, that we contact even the police and other places that people could reach out to and say, do you know, a family member maybe said, look, they may not want to admit anything, certainly to the police department, but they might be, giving them a toll-free number, giving them some avenue to find out where those locations are. I think will be very important to do. But anyway, that's all I have. But like I said, the first issue that I brought up is a big concern to me. Whether or not I'll be able to support it will be dependent on, I want to know what prosecutors and law enforcement, if they see any concerns with this, because I don't want to, as I said, inadvertently trying to do the right thing, causing a problem somewhere else. But anyway, thank you.
Thank you, Commissioner Anderson. Commission Counsel, you have
Yes.
comments on the discussion?
So to that point, this original ordinance was adopted in 2006. I don't think anyone here was involved in the original adoption of the ordinance. But over the last 15 plus or so years that I've been with the commission, I'm not aware of, nor has the commission received any complaints with regards from law enforcement regarding the implementation or any issues with the ordinance itself. So we haven't received any complaints about it. With these amendments due, they exempt certain organizations or individuals or items from the ordinance, which means that a law enforcement agency won't be able to write a citation for an employee of a community organization, or if I have marijuana, but it's an amount that's acceptable under state law, and I have paraphernalia related to that, you can't write me a ticket. So it may limit the number of individuals that they can write for, but it shouldn't change overall what they do and how they implement and enforce this, assuming that they're doing so. If that makes sense.
You have a comment on that, Commissioner Anderson? Yes, he does.
I do, but
Yeah.
very brief. I'm just concerned about whether in paraphernalia in the car, even though they may not be able to write a ticket for it, does it in some way tie their hands as far as looking for something else in the car? And does it limit their duties as a law enforcement person? And does it affect prosecutors, the prosecution for another matter.
Thank you, Commissioner. I've got Commissioner Marecki, followed by Commissioner Baker McCormick. I got Commissioner Baker McCormick.
Thank you, Mr. Chair. So, locations. Do you know when you might have the locations?
So for the initial, this will be rolled out in phases, right? Where it
Okay.
won't be, all 100 won't go out at the same
Oh,
time. So
okay.
there'll be, we'll be rolling out the initial ones. And so hopefully by around late summer, we'll have the initial machines out on the street live. And so we'll be able to provide updates on locations, and we'll have various communications around that. We're planning to do some advertising around it to drive folks to those initial locations as well.
Okay, so we don't actually have any of the machines now.
They're in production right now.
They're in
Yeah,
production. I
yeah.
see.
Mhm.
Okay, and so I would assume that once you have any locations or however you roll them out, that you will provide that list to the commission in a nice little flyer so we can get it out to the community in our newsletters. That would be great.
Yeah, absolutely.
Okay. And then is it a way where you could bring a sample to us, the strips and the actual Narcan, so we can see what that looks like, and maybe we can even, I don't know if there's training or something that, we need to know how it functions.
Yeah,
that would be
absolutely. You know, I
great.
carry Narcan around everywhere. I just don't have my purse with me right now,
Okay.
but it's usually in my purse.
Yeah.
It's right in on the 10th floor right now. But happy to, provide a kit for all the commissioners,
That would
and
be
have
great.
that available. What we try to, I'm an addiction medicine physician as well. That's part of my clinical practice. And what I try to always communicate is that it is, there's no training required. It's easy to use as a nasal spray you use maybe for allergies. And so we try to demystify it, and decomplicate it as
Great.
much as possible. So I'm happy to share that education and materials.
Thank you.
Commissioner Marecki.
Thank you. And to Commissioner Baker McCormick's point, yeah, there's no training with it,
Mhm.
but will there be some kind of, because after
Right.
it happens, there's people can go into what? I mean, they just don't get up and walk away and not,
Right.
I mean, there's repercussions
Yeah,
after
so
that,
we'll
right?
be having like quick reference cards that are really, accessible, simple language, visual graphics to kind of go through the steps, identifying an overdose. So we'll be having kind of these wraparound educational materials that go along with the rollout.
Okay,
Yeah.
thank you.
Just a couple of things. I believe when Narcan arrived on the scene 8-10 years ago. Is that about right?
Well, we've been using naloxone to reverse overdoses for,
Forever.
forever.
But I
Yeah.
believe-
in terms of community access
Yeah.
more recently. Mhm.
And I believe it was about 8-10 years ago that DeWitt started providing this to local police agencies. Do you know if they still do that, or?
I believe they're still involved with that. Mhm.
Yeah, so that's another. The other thing I want to ask is we've had changes to the marijuana law in this state.
Mhm.
And of course, we're looking at a paraphernalia ordinance, and last I checked, marijuana and paraphernalia kind of go together. Did we look at this ordinance with an eye towards, are we putting anybody in danger from what is now legal activity in terms of what you can have and where you go? Did we look at it? Are we going to impair people's rights under the new marijuana law in the state?
So when this ordinance was drafted, it was drafted with an eye towards looking at the marijuana paraphernalia and trying to put that on par with the recent legalization of marijuana at the state level. So there were changes made to prevent an individual who is, legally using marijuana from being charged with a paraphernalia ordinance violation as well.
Because as I read in the paper, and yes, I read a newspaper, people are doing their daily chronic more than people are taking a daily drink these days. And so the use is up tremendously under the new law. We don't need to start hauling people down to jail because inadequacies in the ordinance. Okay. Committee members, are we ready to bring the public in to this discussion if anybody wants to discuss this? We would need a motion to go to a public hearing, and that'll be a roll call vote to go into public hearing.
So moved.
It's been moved and seconded to go into public hearing. Please do what you need to do to vote yes.
Commissioner Baker McCormick,
Yes.
Oh.
Commissioner Marecki,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
Hi.
motion carried.
All right. We're in public comment. I guess I'll start with, do we have anybody on Zoom, Madam Clerk, that has a hand up for comment on this proposed ordinance?
No hands raised.
Have we received any emails?
Oh, we do have a hand raised now. It's Ashley. Last name Shukait.
All righty. Ashley, are you ready to join us? Turn on your mic.
I am.
Welcome. Name for the record, and then please, your comments. You got 3 minutes.
Hi, my name is Ashley Shukai. I am a syringe service program provider. I am primarily in Western Wayne County. I have been providing syringe access, including naloxone and fentanyl test strips, since 2003.
Wow.
I give out thousands of naloxone and reverse hundreds of overdose and over the last several years alone. The many community members who I cannot always provide access to supplies to keep them alive are throughout various cities and have a burden from the local paraphernalia ordinances. Because as we all know, sometimes just driving down the road, we're in various cities and townships. As I mentioned this, the support of the vending machines is not only protecting the individuals who use drugs on a regular basis, but this is protecting our children who may not ever ask an adult for naloxone, who are dying at disproportionate rates because the drug supply is so unpredictable and toxic. So I ask that you bring us all to the table, who many are terrified to operate within Western Wayne County because of paraphernalia charges $800 to $1,000 and 90 days in jails for providing a public health intervention. I have emailed a large packet from the Michigan Drug Users Health Alliance, and I encourage you all to read it and come with us, other harm reduction providers, to learn what we do to save lives in this county. The majority of our individuals do not call 911, and we keep our own data, and the Michigan Department of Health and Human Services are aware of our numbers in the thousands to reverse and save lives. Thank you.
Thank you very much for your comment today. Anybody else on Zoom have a hand up? Any emails?
No emails were received. There are a few people in the chat that are writing. There's a Z St. James. I'm not sure if they wanted to speak, but they are making comments in the chat.
Any other person on Zoom, if you'd like to hit your mic and join us? Anybody in the room with us today that have comments on this proposed ordinance? Hey, nobody here. I'll go back one more time to Zoom. Is there anybody else on Zoom that would like? Yeah, is there anything in the chat?
Yes, from a Z St. James.
Thank you. Yes.
It says Detroit's ordinances don't cover pipes or safe sniff inhalation kits, which are important to for many reasons. People who are using other types of drugs and are opiate naive still deserve to legally get their supplies without police harassment. This prevents Hep C and HIV for Wayne County, for which Wayne County has several hotspots. There are also less risky ways of injecting drugs when compared to injecting syringes. Harm reduction programs distribute these openly, but participants and even staff technically are not protected.
Okay, thank you. Anything? Anybody else, Madam Clerk?
No one else. There are two other comments by Z St. James. One is cameras would not be a deterrent to, and the other one says if people sell it, that means there is not enough access.
Okay, Chair's gonna say we've got public comment, all that would care to have some. So we'll need a motion to end public comment on, yeah,
Think I,
to
yeah.
come out of, yeah,
So moved. I think I,
and support. And I think this is just a voice vote.
yes.
Yeah. All in favor of coming out of public hearing, say aye, please. Aye. Opposed? No opposition, so we're back to an open meeting. If I may, and forgive me on your last name, Dr. Steth?
Chef,
Say it again.
chef.
We're working on it.
Yeah,
Mhm.
like a chef.
Yeah, well, I like to get it right. Given the comments that we've heard and a couple of questions here, is the health department going to have a little bit of an ongoing? Because I think a couple of important points were raised by people that are in the field. You know, I heard reference to the drug supply. You never know where meth and those things are going to turn up. They're putting them in everything. Is the health department going to have some conversations with frontline people, including like where local ordinances could possibly be a barrier? You plan on going down that road? If I'm being clear.
Yeah, I think I understand what you're saying. Yes. And so we are, as part of our, rolling out of various, overdose response strategies, we are conducting a needs assessment where we will be seeking input formally from, these frontline providers with such valuable insights into the barriers and gaps in the continuum of care and services out in Wayne County. So we'll be gathering valuable input from them. And we have also had informal meetings with various providers as well to understand this, what their experiences are. And this is where we kind of found this on the ground experience of these barriers that these providers have specifically in going into Wayne County communities. And, you know, our Wayne County ordinance and making these changes are a significant step in showing that, you know, we are leading in this and these efforts. And we hope that our, you know, fellow colleagues across the municipalities and townships do the same.
I love that we're looking at this through a factual public health lens. Is it fair to say that opiates of all sorts out there are increasing at what we could perhaps call alarming rates among our citizens?
So what we're seeing right now is, you know, the drug overdose epidemic has gone through different waves. And what we're seeing right now is that, yes, fentanyl is driving still the majority of overdose deaths. But the other drugs that are involved sometimes are not even other opioids. So we are seeing a lot of combination of fentanyl and cocaine, fentanyl and other psychostimulants like methamphetamine. And so we are seeing that the drug supply has significantly evolved, and there are newer and newer emerging substances that continue to make the supply unsafe out there. And so we are monitoring this data closely. We're trying to put out the tools like fentanyl test strips, xylazine test strips, so individuals are empowered with information to make positive behavioral changes and reduce their risk of overdoses. And, you know, we anticipate the drug supply will continue to change as it has done.
And overall, it's on the rise.
In terms of overdose deaths, so there was a slight decrease at the state of Michigan in 2023. We're still looking at our Wayne County data to see how this has impacted our data. But it's still, nearly 3,000 deaths in the state of Michigan in 2023. So there are ideally, we have gains in these numbers over time, but we know that we are continually having to pivot our strategies because the drug supply continues to change. And so there's always worry of losing any of those gains as we move forward.
That's 8 or 10 Michigan citizens a month that are dropping dead from this. Okay. Commissioners, I guess we're looking for a motion to move the amended proposed ordinance. We'll need a motion on that. And yeah, Commissioner Baker McCormick moves the amended proposed ordinance. Do I have a second? Commissioner Marecki seconds it. Any other discussion on this item? Commissioner Anderson.
I would like to ask if someone would reach out to the prosecutor's office and the sheriff's department to have them take a look at this before we take it up in full board.
Yeah, if someone from the prosecutor's office could join us on that day
Mhm.
before the commission votes and gives their opinion.
Or in writing,
Yeah, one way or another, communicate.
right.
Okay,
And that'll determine whether or not I vote for it in the end.
understood, sir. Okay, we have a motion and a second before us. Please vote on your little patty thingies. Yours didn't come up?
No, it's got full score of.
Okay,
Are you a yes vote?
icons.
yes, no, or
I'm a yes.
abstain, sir. Yeah,
Yes.
Motion carried.
okay. Thank you all very much. Good discussion here today. Madam Clerk, next item.
Item 2, requesting commission approval of Amendment 2 to a 4-year memorandum of understanding with the Wayne County Prosecutor's Office to change funding account number to continue the Right Track diversion program at the Third Circuit Court Juvenile Division.
Okay, one of our many diversion programs that we have. I see we've been joined by administration. Would you gentlemen please give your name and titles and give us the lowdown?
Yes, good afternoon to the Honorable Chair of this body and to the Commissioners. Nathaniel McQueen, Juvenile and Youth Services Chief Programming Officer.
Tucson Knights, Division Director of Prevention and Diversion.
Alrighty. Would you like to lay out in plain English for us what
Yes, I
what
think
this proposal is about?
to simplify the understanding of it. So there are state dollars that go to the prosecutor's office for this particular program right here. And this program has come about, and it was in a particular line item for budget purposes and it is being a new budget has been set up. Account has been set up for Mr. Tucson, his division. And so now where the monies were coming out of to pay for this, it is now going into the new budget that has been set up.
So the money's not changing. We're just putting it in a different pocket than we used to.
Correct.
Anything else on this?
No, sir. He summed it up really well.
Is there a congratulations in order, Mr. Knight? I didn't hear division director before your name.
You helped approve me last time.
Did we?
I think he made the motion.
I probably did. Some things, everything that goes across the
I know,
table is
right?
not blazing in my memory. Questions from commissioners on this item? Hearing no questions, I'd be happy to take a motion. So we have motion by Commissioner Marecki, second by Commissioner Baker McCormick, if I'm looking at that. Any other discussion of this item? We have a motion and a second. Please use your little pads to vote. It'll appear on the screen for those on Zoom.
Are you a yes vote?
Yeah,
Motion carried.
yeah, now we go. Thank you very much. Thank you, gentlemen. Madam Clerk?
Item 3, requesting commission approval of Amendment 10 to a 2-year contract with 3 one-year options to renew with Black Family Development to increase funding in the amount to account for the fiscal year 2024 second quarter payment adjustment to continue providing comprehensive treatment plans to juveniles in accordance with requirements of the juvenile justice system.
Alrighty, thank you. Items 3 through 7 are the care maintenance organizations, the CMOs that the county funds for juvenile services. Every quarter, their encounter data comes in, and then we make adjustments a little bit up, a little bit down for each one of the CMOs, depending on what their encounter data for that quarter shows. Commissioners, any questions on this? I think it appropriate, we could take a motion for items 3 through 7. I'm sorry. Already there. We have a motion to approve, and it's a second by Commissioner Baker McCormick, a second by Commissioner Marecki. Any other discussion? Oh. No. No. Okay. Motion in a second. Please use your voting pads to express your vote. Now we got, there we go.
Motion carried.
Thank you. Madam Clerk, I believe we're moving to the addenda.
Moving to the addenda, item 8, requesting commission approval of a 1-year intergovernmental clinical outpatient service provider agreement with 2 one-year options to renew at the sole option of Detroit Wayne Integrated Health Network.
Okay, thank you. Both items 8 and 9 are with Detroit Wayne Integrated Health Network. 8 is for juveniles. 9 is for health services in the county jail for adults. And we are funded actually by DeWin for these programs to run them in the county. If I may, I want to start with Commission Counsel. Commission Counsel, in your analysis and questions here, there was some money that was spent before the commission approved that money to be spent. Do you care to comment on that and where we stand with that?
Through the chair, so both of these contracts are for mental health services, and DWIN actually provides funding to the county, and then the county contracts through some vendor to provide mental health services. So for the jail, we use our jail provider, which is NAPCare. And I believe for the youth, it's Assured
Family Services. Yeah,
So in this instance.
it used to be called the Jack.
Right.
For old timers.
So in this instance, services have simply continued. It's not that the county has paid out any money because DWIN is providing us money, but services have continued. So the county has been essentially acting under a contract before it's been approved. But again, these are mental health services that are required to be provided, and they're going through the county to do so. So the services have continued to not have a disruption. That's why you have the analysis saying that they have started without proper approval. However, it is related to mental health.
Yeah. So, counsel, that means the options didn't get to us on time, which is why work continued.
Yes, essentially, the contracts just lagged behind the actual start dates, which I believe were October 1.
Do you have any issues at this point moving forward with these two motions?
No, mental health services is essential. I believe some money has been paid to the county by DWIN for one of the contracts. But no issues.
Okay. Thank you. Discussion, commissioners? I think I will take these one at a time, because they're different. So is there a motion for item 8? Commissioner Anderson, is that, you lost your touch screen again? Commissioner Anderson moved it. It's seconded by, oh, somebody's doing it on your behalf. How about that? Seconded by Commissioner Baker McCormick. Motion and second. Any other discussion? All in favor, please cast your vote. Sorry.
Motion carried.
Thank you very much. Do you have a, what do you call it? A proxy? You got a proxy here, Commissioner Anderson? Okay, next item, Madam Clerk.
Item 9, requesting commission approval of a 1-year intergovernmental clinical outpatient service provider agreement with 2 1-year options to renew at the sole option of Detroit Wayne Integrated Health Network to support the provision of mental health services in the county jail.
Thank you. And I believe, somebody tell me if I'm wrong, I believe this goes all the way back to the enabling resolution when we created the Detroit Wayne Mental Health Authority, as it was called at the time, that we had a provision in there that DeWin would fund our mental health services in the jail. So this is a long-standing requirement that the county has had. Questions, comments from commissioners on this? Or Baker McCormick? And Commissioner Marecki can second it. Where'd your proxy go? Any other discussion? We have a motion and a second, item 9 on the addenda. All right, we'll go to a vote. Please use your pads and vote. If you don't have your pads, call your proxy. Somebody's gonna have to get paid for that. There we go.
Motion carried.
Thank you very much. Next item.
F, such other matters as may be properly submitted before the committee.
I have none. Next item, please.
G, public comments.
Any member of the public wish to have comment? Anybody on the Zoom that would like to have comment? Please raise your hand. We've already established there's no one in the room. Any hands raised, or did we get any comments in the chat?
No comments in the chat and no hands raised.
All right, one last time, call for public comment. Hearing none, Madam Clerk.
Adjournment.
Without objection, the committee stands